And welcome back. Today we have UofL Health's Dr. Andrew Swiergoz with us to talk about an innovative surgery option that can help alleviate pain. So thanks for coming on, doctor. We appreciate it.
Absolutely. Thanks for having me.
Absolutely.
So today we're talking about the surgery that utilizes a robotic arm. Can you tell us a little bit about the types of procedures that you're doing with this?
Sure. So what we're doing with this right now is primarily hip and knee replacements.
Okay. And talk a little bit about the surgery itself. Like, how is this different, you know, from a regular surgery using the robotic arm? Explain it to us.
So before we had robotics, we used manual cutting jigs and alignment rods to make sure we had the alignment in the appropriate position of the implants in somebody. And it was sort of a one-size-fits-all mentality to approach to, you know, balancing a knee replacement. And now what we're able to do is the patient gets a CT scan before surgery, and that information is loaded into the robot. And so now it's more of a customized feel because no two people's knees are the same, and from person to person they're very different. So what we can do is really accurately dial in how many degrees one way or the other we want the implants to be for preparation of the bones, and then putting in the final implants.
Interesting approach. Okay, so why did UofL start using this technology and when?
Yeah, absolutely. So they've been doing them for a little over 10 years, actually, so is how long this technology's been out. And again, the big thing is just pushing the envelope. You know, if you have a tool or an instrument that can make something more accurate and improve patient outcomes and how they do after surgery, you know, why not do it? So we've been doing it for quite some time, and we've seen the patient satisfactions go up as a result.
Does a person come in to operate the robot? How does it work?
So the robot, to your point, it's a robotic arm that is connected with a CT scan of the patient, and I, in surgery, am operating the robot, but there's a technician in there at a computer screen who, you know, I'm telling them I want them to put so many degrees of rotation on this component and flex it so many degrees, and we're basically doing all the planning in space on a computer before we actually commit to doing it in the person.
Wow, okay.
What kind of feedback do you hear from patients who actually use this and undergo this particular procedure?
Yeah, people are overall very satisfied. So historically, satisfaction scores after knee replacements were anywhere from 80 to 85%, but that left 15 to 20% of people, you know, not loving their knee replacement. And what we've noticed is with the advent of robotics and where we've been able to give people more of a custom feel to this, you know, we're seeing our satisfaction scores be upwards of 90%.
Is the recovery period better for patients who use the robot versus those who don't?
There's mixed data on that, but anecdotally, yes, just because again, you don't have to do as much soft tissue stripping and exposure to be able to see to get all these manual instruments in, because we're doing our plan on the computer with the robot, and then the robotic has, you know, boundaries where if I try to deviate from the plan that we've set out, the power to the robot will just be cut. It won't let me deviate from the plan.
Wow.
Very interesting. Well, thank you for all of this. Where, if people want to learn more, should they look?
Absolutely, on our website at UofL Health, and if they do a short Google search with the Stryker Mako robot, that's the one that I use. I'm sure there's tons of information out there.
Awesome. Thank you so much, doctor, for coming in.
Absolutely.
Really interesting stuff.
Thanks for having me.
Okay.